how's Kenny been doing this? When I go, is he gonna meet me and I will send this laptop?
Yes.
Yeah.
He's just been at the station.
Yeah.
He's gonna be dumping on mine too. So I'll forget to call him before he gets here.
Nice.
Merry Christmas.
Yeah, so this is our, so.
I have no idea.
This is the one. That was one.
Oh, yeah, probably. So you should have audio feed. Testing, 1, 2, 3, 4. Good?
This three's just giving up.
Lost
Three
three.
is just giving up on Tucson.
But they have been coming.
Until Friday they were. And they weren't here Friday.
Are they good with that spot? Is that?
Well, this one was, but I can move because I know yours is more than you.
It's okay, I can move
all
over.
about me here.
It's okay.
Do you want me to go stand at the podium?
Yeah, yeah, can you? Thanks. Okay, that should be good. Thanks, Dan.
You guys streaming that?
Just the physical. Up. when we started using these, we put them on the ground. And they did just between the ground and the table, made a lot of difference.
We have to make everyone happy. I'm so sorry.
It's okay. I'm glad it's fixed. You're fine and
I am,
we can
yeah.
see you perfectly
You
and
can.
you're not muted. Very good. Good morning.
Good morning. Good morning.
Morning.
Good morning. How are you?
How are you?
Yes,
Thank you.
Okay.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Good. Good morning. And welcome to our Monday briefing here on March 30th. So the governor's recent press conference, there's some exciting news we've heard. As you've heard of Battelle, Ohio-based company has established a methodology for sterilizing N95 respirators for reuse up to 20 times. And we're excited to hear that the FDA, through the governor's intervention, has expedited approval for this process. And according to Battelle, they can process up to 80,000 masks a day. This is very critical. As you know, we're in a situation where the flow of personal protective equipment and the demand don't match. The demand is far outweighing the availability of personal protective equipment. And so we look to the challenges like places in New York and certainly on to the West Coast, they're facing around available personal protective equipment. We're excited about this Ohio development and what that might mean for extending the life of personal protective equipment, which is vital for first responders and for hospitals and other folks on the front lines. So that's great news. We have a call center, as you know, that's been working to address a range of resident concerns and also calls related to essential businesses that relate back to the governor's stay-at-home order. And so we've received to date 1,560 calls related to this essential business designation through our phone bank here, and the majority are tied back to whether the business is essential or not. So we make that determination in 554 calls. 107 of those calls were tied to businesses making judgments and gaining information about social distancing and how to assure that adequate space is maintained where possible in terms of reducing exposures to both workers and potential patrons. Complaints about businesses that are not following orders have also been received. There have been 312 of those, and we are in the process, our field staff, of responding to these complaints and addressing those businesses that are not essential and assuring that they take steps to organize their business remotely or to stop temporarily their business during this time. So that's underway. So we've notified many non-essential businesses about this order and where we stand. And so this is they're from a variety of sectors. So I'm going to walk you through those. Barbershops, hair and nail salons, bars and restaurants, car washes, driving ranges, gym, dance, yoga, and fitness centers, massage therapy locations, and non-essential retail stores like clothing, furniture, craft, beauty, gaming, and sports goods, as well as vape, CBD, and smoke shops. Those are all non-essential. If you have a concern, call us on our line here between 8:30 and 4:30 at 216-201-2000, and we will help you work through those concerns. If you have a resident and you have a complaint about a business that you feel is not following the governor's stay-at-home orders on essential businesses, let us know, and we'll respond to those. Please do not file COVID-19 complaints by email through our website or by emailing a staff member. We're establishing a flow here, as we've described in several of these discussions, to try to develop a manageable workflow going forward, and so that's imperative that folks help us with that. In terms of responding to complaints, we're moving as quickly as possible given the volume of complaints that we've received, which has been immense. And so we appreciate your patience with that. I want to remind you that every Friday we'll be focusing on data. That'll be a weekly one-time event where we roll up activities from the previous week, and Dr. Gullett will be featuring a range of data around confirmed cases at the zip code level in maps going forward, and other related data that we think is critical to share in the community related to hospitals and several other fronts, our EpiCurve and the like. So you can find all that information, most recent information, on our website at ccdh.net. We have a coronavirus webpage, and we'll make sure that we update that weekly with the latest information. And we really want you to heed the reminder, and I'm going to tell you why in a moment, but let's talk about these things, about staying home as much as possible, particularly when you're sick. We were here all weekend working on case response, and we're still seeing a lot of cases here in Cuyahoga County and around Ohio. We're still seeing a lot of cases, and we're responding and working on quarantine and isolation of close contacts and cases. And so we want to limit your contact with other people. Limit your contact with other people, and stay away 6 feet away from people so that you're trying to create that social distance and prevent and reduce transmission. And what is important to understand now is that we're hearing, based on feedback, some interesting news in Seattle that's been reported in the news lately. So we were all looking to the west as cases were first detected in the United States, and saw the Seattle area facing the first, really the brunt initially of cases in the United States. And we were learning from Seattle and the King County area about their response. And so what we think is promising is that they're seeing some headway around their aggressive social distancing efforts, which appear to be making a difference. The number of close contacts exposed by each case seems to be dropping. So for every case, the number of close contacts that may be exposed appears to be dropping in the Seattle area, which they're reporting that early on in March, 2.7 close contacts were identified per case, and now here in late in March, they're seeing 1.4 close contacts identified per case. This is very promising. However, Governor Inslee in Washington has stated that Washington is still 1,000 miles to go. They're encouraged by this news and feel, from our standpoint, we feel that Ohio's protective decisions around social distancing, around crowds and mass gatherings, around reducing non-essential business activity, as hard and disruptive as it is, as difficult as it is for people, how it's affected jobs, how it's affected people's lives, how it's affected the schools. We look to Washington, which is a few weeks ahead of us, as a sentinel as to perhaps what the benefits and the returns on what Ohio is choosing to do will have for us in Ohio. So we're following the data, we're following a playbook, and it's a strong public health approach, and I think people should understand that. We'll watch what's happening around the country, and there are places with some very, very difficult challenges, making very difficult decisions around patient care. And we here in Ohio don't want to be faced with that, and Dr. Gullett will elaborate on that. Yesterday, I was very happy to hear Governor DeWine say that it's time to reinvest in public health. Often, people recognize state and local health departments in these moments, emergencies, around H1N1, around Ebola, and various responses. But on a day-to-day basis, we're keeping your food safe. We're doing home visits for moms with newborn babies to help keep those babies safe. We're inspecting septic systems that are still in this county to make sure that their discharges are not polluting the environment. We're inspecting schools. We're doing smoking prevention in communities. We are working in clinic to vaccinate your children, your grandparents on a daily basis from a range of infectious diseases. We are communicating and educating the public on prevention messages, and often that work goes unnoticed. It's been said by a former state health director that public health is the greatest story never told. And here on full display, the work that public health is doing across this country, and among my friends here at state and local health departments that I've worked with on a national basis, and particularly in Ohio. You're seeing now the benefits of public health prevention messages around quarantine and isolation to hold back the onslaught of cases through prevention so that our hospitals are not overwhelmed, our EMS is not overwhelmed, and we're going to continue on that course because it is good public health prevention and we're committed to serve Ohioans. With that, I'd like to turn the podium over to Dr. Gully.
Thank you.
Good morning. Welcome to another week. I'd like to thank all of our media partners who are here with us in the room, who continue to provide excellent reporting, and also their media colleagues that are back in their offices. We thank you so much for what you continue to do for our community in that regard. Those of you who are regular viewers know that I feel very strongly about recognizing a lot of different groups on the front lines of this response in this difficult time. And gratitude is a theme that we're going to continue to remind everyone about as long as it takes to get through this time. So today I'd like to recognize a few groups. I think it's really important that we continue to appreciate one another and continue to call out what is everyone rising to their very best through this difficult time. So I'd like to thank all those folks who have been staying home. We recognize that's not easy. I know it's not easy. Our team knows it's not easy. I had some of my patients contacting me at home, or contacting me from home saying, it's really hard for me to stay home, and and I know that, and we know that, but that's the safest place for you to be right now. And so I just want to say thank you for doing that. We did have reports called into us this weekend about groups gathering that were not staying home, and to those folks, I would just plead with you to please stay home and please not gather in groups. This is really, really critical, and this is the one thing you can all do. But for the thousands of you in our community who have done that and continue to do that, thank you. It's a critical piece to reducing the spread, slowing the spread, the transmission of this virus, and to flattening the curve, and it's something that all of us can do. I'd also really like to thank the food service employees across our community. There are thousands of employees that are in essential businesses working hard to make sure the rest of us serving on the front lines in different capacities have food and can eat. And I know that there are a couple local businesses here that kept us fed all weekend and really are trying to do social distancing in their kitchens and among their staff, and working really hard to adhere to all of the foodborne illness safety precautions they normally do, but then adding the social distancing piece in. So we thank you. We know you're leaving your families and you're out in the community potentially being exposed, and you're doing that so the rest of us are able to continue to do our jobs, and I thank you very much for that. We all here at CCBH thank each of these groups, and I'll continue to highlight different groups throughout each of our media briefings, but we thank you for your kindness, your support, and the humanity that you bring to your jobs every day, because you are an essential part of this response. As Terry mentioned, and I mentioned also on Friday, we're going to continue to give you regular data updates, and on Mondays and Wednesdays I'll be giving you our CCBH jurisdiction data, so that's the data for the county, with the exception of the city of Cleveland, who separately reports, but we're working hand in hand with them. They're our closest regional partner. And then we work also with the surrounding counties, because a lot of people come into our county for care but live in other jurisdictions. So the data I'm going to present to you on Mondays and Wednesdays will simply be the people who are either infected with this virus in our jurisdiction who live here, or unfortunately if we have deaths, I'll report on those. And then on Friday, I'll continue to report on the epi curve for the county, which includes all of the county, as well as the map, and we'll continue to update that so you can see the evolution of what the case counts look like in our community over time. So as of last night, when we pulled the data for presentation in the press briefings the night before, because these are continuously rolling in, so this is constantly changing, it's very fluid, so what you're gonna hear me present each day and what I've been presenting is what we get before we leave here late the night before. So the lab confirmed cases in Cuyahoga County and the CCBH jurisdiction are 338, and the age range of those cases is 14 to 93. You can see that we've had an acceleration of cases, new lab confirmed cases over the weekend. We're significantly increased in the daily new case count for lab confirmed cases than we had previously had in previous weeks day to day. And I want to reassure you that we're steadfast in our commitment to the plan that I've continued to outline for you, which is multifaceted and has a lot of components to it, but the foundational component is case identification, meaning we identify cases, and then we talk to folks about what exposures and contacts they've had, and then we track down those contacts and make sure those folks are quarantined and they understand what that means. Any cases, we make sure folks can isolate safely and they understand what that is, and then quarantine. If people become symptomatic, they know to contact us, and then we talk them through the transition then to isolation. It's critically important that this continue to happen despite the acceleration of cases, because we know, and particularly from places like China, that a lot of the transmission happened with close contacts, household contacts. So we've got to be very aggressive about making sure everyone affected by this virus has the information they need to safely isolate and safely quarantine to prevent future transmission. So I want to reassure you that our team here is absolutely dedicated to this strategy, and we are going to continue it as long as it takes. I also am going to present to you this morning some unfortunate news about additional deaths in our community. And I want to remind you that every single person represented in these statistics is an invaluable member of our community who we have lost. We have 29 deaths across the state, and we now have 4 in our county. The age ranges for the deaths in Cuyahoga County thus far are age 70 to 91. We have had 2 males and 2 females. And the dates of death have been March 20th to March 28th. And I would just ask people to continue to support these families as they face their own potential risk for infection, but they also grieve their families in ways that are difficult than even in the normal circumstances when you lose a loved one. Here in Cuyahoga County, we have 338 cases, and just a week ago statewide we had 351. So you can see the acceleration is pretty significant. And on Fridays you'll be able to see what the epi curve looks like. We're hopeful that all of these things that we're doing to flatten the curve, whether they be the things I described to you here that we're doing at the County Board of Health, or the things we're asking you to do at home by staying at home and minimizing anything except absolutely necessary trips to the store, getting food, those things are the things that are going to help us get this curve flattened quicker. But you see the acceleration, so we cannot let up. We cannot stop these efforts at any time in the next few weeks. We'll continue to update you on that, but please understand this continues to evolve very quickly. I also want to address testing for a few minutes. I know folks are probably at home watching the news a lot because there's not a lot of other things to do, I guess. And you're seeing a lot reported about rapid testing. You heard Terry reference it. Some changes in N95s. You see there's a lot of research happening very quickly. That maybe is one of the silver lines to this, is that we have some acceleration in research developments around cleaning, personal protective equipment, and around testing. None of that rapid testing or those quick testing capabilities or ambulatory testing capabilities are present for us in any way here locally. So I want folks to know that we're keeping an eye on that. We will continue to monitor that, and we will continue to report out to you at our press briefings when we have availability for additional testing. But at this time, we're still going by the Ohio Department of Health and the Centers for Disease Control and Prevention recommendations for prioritizing testing, given the limited testing availability. And those tiered testing strategies are available online, but just a few highlights in that certainly hospitalized patients remain a high priority for testing, as well as those in communal living situations, long-term care facilities, skilled nursing facilities, et cetera, as well as healthcare providers, healthcare workers, and first responders. We've got to protect those folks and so that they can continue to take care of us. And I mentioned that on Friday and we'll continue to highlight that. So those are certainly areas where we're going to continue to focus testing until we have more widespread availability for testing. On Fridays, I also talked to you about the hospital utilization at the county level, and we'll continue to monitor that. We actually monitor that on a daily basis, but we'll report out on Fridays so that viewers can understand what kind of, when we're approaching our capacity around hospitals as you see the acceleration of cases. We're hopeful that most people can take care of themselves at home, that they'll remain stable with mild infection at home, but there are a significant number of people who need hospital level care. And so part of what's the challenge for doctors these days and providers these days is sorting out who can stay at home and who really needs that higher level of care. And that's partly what we're providing here as well to cases we've been in contact with and contacts who then become symptomatic. But we want to reassure you that we're continuing to work very closely with our hospital partners as well as the Regional Hospital Association, the Center for Health Affairs, to make sure that all of us are working together around what capacity we have for hospital care. As Terry mentioned, I mentioned on Friday, we don't want to get to a place where resources limit our ability to provide the very best, highest quality care that we're known for in this region. So we're doing our best on the public health side to minimize a surge on the hospital side. I'd like to just finish my remarks this morning talking about health and what comprises health. Health is so much more than just our physical health, although in these recent days and weeks we've been very focused on physical health because this virus affects us physically in really profound ways for those who have been infected. But our mental health and our spiritual health, all of that is part of our health. And so we as a health department actually take that very holistic approach to thinking about health. I do the same thing in my clinical practice. I don't just want to partner with my patients around their physical health. I want to partner around their whole health. So I'd like to talk about behavioral health and mental health for a few minutes here. This is truly unprecedented time for all of us. It's a very difficult time. Life is hard anyway, let alone layering on something like a pandemic that has, in the matter of just days and weeks, completely redefined the way we live. And that's something that all of us have to face every day. And if you're somebody who already is established with a behavioral health provider, I would strongly encourage you to maintain contact with that provider. But if you're someone who hasn't accessed behavioral health services in the past, I'd encourage you to think about that. Those are our key partners in care, and we all need to make sure that our mental and behavioral health needs are met during this time. And that's all of us. That's healthcare providers, that's everyone on the front lines, all the people that we keep talking about that are out there fighting on behalf of the community, but also those at home. And so I'd like to just give you a few numbers that you can call if you're looking to reach out and aren't sure where to go. From the Adams Board website, there are some hotlines that you can call. There's the Cuyahoga County's 24-hour warm line at 440-886-5950. That enables you to talk with a peer. You can also text 4HOPE to 741-741. That's the crisis text line. And if you're in crisis, there's a 24-hour suicide prevention, mental health, addiction crisis information and referral hotline at 216-623-6888. These are tremendous partners in our community, and they're here to serve during this time and at all other times as well. All of us need self-care right now, and that looks different for everyone. Managing stress is very personal, but I would encourage everyone to find something that helps them get through this particularly challenging time. Sometimes that means unplugging from our devices. Sometimes that means exercise in a safe way, socially distanced appropriately, of course. And sometimes that means figuring out a way to connect with folks socially, but not necessarily physically in the same place. So physical distancing, the social distancing we talk about is not social isolation. We want you to remain connected. So I just want to thank you all for tuning in again today. We'll continue to do these regular updates because we feel it's important to make sure everybody has the information they need. And we'll be back on Wednesday with more information for you. Before we wrap up, we'll take a few questions.
You know, on Friday, you had presented us our kind of first look at what our local epi curve looks like. And I'm wondering, you know, we've heard comments from Governor DeWine, perhaps the first week of May statewide, perhaps the second week of May statewide. Do you have any sort of insight on what the Cuyahoga County curve looks like compared to the state curve, and whether we're behind, ahead, what that looks like?
Sure, so the question is, how does the Cuyahoga County curve compare, epi curve compare to the statewide one? So the one I presented on Friday as compared to the statewide one that Dr. Acton continues to present with Governor DeWine at the regular press conferences. So epi curves are really what we call retrospective, meaning we're looking back at the data, and we're trying to do it in real time, but it's still data that's already been collected. So sampling, learning when people were sick, those are the things we're putting into that curve that we're presenting to you. And when we give projections about timelines in the future for when the curve might come down, that's forward thinking, that's modeling, thinking about what's going to happen. So they have to kind of go together, and modeling requires assumptions, and it requires us to have certain things in place before we make predictions. And so I don't feel necessarily that at the county level I can tell you anything about timeline predictions apart from the state. I will tell you that we are the area of the state that has the most cases lab confirmed right now, but we also seem to have more testing than others. So I'm not sure that that necessarily means we have far more cases. Rather, we had a lot of testing. We were able to test earlier maybe than other parts of the state. So for projecting what our curve and when it's going to come down as compared to the state, I don't feel that I can do that right now. Actually, a couple of us sat yesterday and had this very conversation trying to do that. I would love to be able to stand up here and tell you that, and I know a lot of our school officials and others would like to know too, right? So what are we going to do with the rest of the school year and those things? But we're working very closely with the state officials around that. I'll tell you our epi curve looks similar to the state, given that we are a large proportion of the state cases. But I hope that it'll be helpful for you as we continue to show you each week the progression. And as our cases have accelerated, I think our epi curve will look quite different this week than it did last week, and you'll be able to see that we're still rising. We are not, locally, we are not on the other side of this curve yet.
On a different note, thank you, Dr. Cullett, I wanted to say something. So this weekend, a number of communities reported flooding from the downpours that we had. And so there's some folks in a tough spot around the community. On top of this, these issues related with the disruptions from the COVID-19 pandemic that we're dealing with, I heard from a number of mayors that are concerned about residents and flooding, basements and the like, and the impact on top of this. So we're thinking about them today and this week as they deal with the aftermath of those floods. It's a very unfortunate situation. So what we want people to know is that there's nothing specific to COVID-19 in terms of response that they need to understand. We have lots of information on our website related to flooded area safety and sanitation that's been there for a long time. It's based on state and federal guidance around cleanup, around disposal, around proper drying methods on what can be recovered, and other things that should be, out of an abundance of caution, thrown out. So we encourage you to look at the guidance around flooding exposures and safety during cleanup as folks are dealing with the aftermath of the floods.
And going back to talking about the hospital capacity, are the dorms and hotels, are those still on the table as far as using them as makeshift hospitals?
So the question is around surge capacity and increasing other areas where bed capacity could be increased. So some things that were just mentioned were dorms and hotels and places like that. So on the public health side, we're closely monitoring and listening to what our hospital partners are doing with planning at the state level, and Dr. Acton, I know, has referenced some of those plans. I don't have anything specific to report about the county this morning, but I know that those discussions are happening with all of our hospital partners. So there's a certain amount of what we call surge capacity or increased beds within the existing hospital structures. But then there's a different level of surge capacity planning that is creating beds in other spaces that aren't normally used as hospital facilities. And I think both are being certainly considered and discussed when we do our planning exercises and our tabletops to prepare for things like this. Those are the things we walk through, but then when you get into a real scenario, you have to look at what's actually possible in the moment. And so I think we will hear more about that as the days and weeks unfold. Another thing, though, that we need to think about are ways to protect our healthcare workers between their shifts, our first responders and our healthcare workers. So we are looking at ways to also see if there are housing opportunities apart from their own homes that would enable them to then not have the risk of bringing the virus home, because we know all of our healthcare workers and first responders are exposed on every shift at this point, given the high prevalence of infection in our community. So that's another piece of thinking about creatively using other housing. And I don't have anything specific to report about that, but I wanted to just say that those are ongoing conversations at the county level, and our County Emergency Operations Center is sort of the hub that's really thinking through all of those things.
Talk about the acceleration of cases. Is that people who you believe were exposed before the stay-at-home order, or people who aren't listening to the stay-at-home order, or what's kind of behind that as far as you can tell?
Yeah, so the question is, were the cases that I described as accelerated, the significant increase in cases reported to us, lab confirmed over the weekend, were those from people who were exposed prior to the stay-at-home order or since the stay-at-home order? And it's really a mix. So we're still calling every single person and getting a history from them about when they were symptomatic and what their potential exposures could have been. But I do think it's a mix. I think we have a lot of healthcare and first responders who are exposed, and they're doing their very best with the PPE they have, but their exposure is of no fault of their own, and so it's irrelevant to the stay-at-home order for those particular folks who are now positive. But we do see other folks who had exposures and symptoms happening before the stay-at-home order and some since. Household contacts are also a significant number of our cases. A lot of those actually aren't getting tested because they're mild infection, but we're treating them as cases because they're now symptomatic and they have somebody at home that's isolated. So that's the other comment that I made earlier about trying to make sure we minimize exposures in the home. That has been another source of the significant increase in cases that we have seen in the last few days.
So it's kind of one person brings it home and then it just spreads.
That's one route of transmission. We're seeing multiple routes of transmission. There's clearly transmission in the workplace, people who are working in healthcare settings or in first responder settings. There are people who are working in other settings which may be their exposures, right? They're essential workers and they're out there and they may not have PPE, and somebody may, come by and they have that interaction and that's how they get exposed. But then there are also quite a few household contacts who then have become exposed and who are new cases. And then there are folks who are not heeding our warnings and who are gathering in groups, and we have had multiple reports of those as well. And so that's why case investigation is so important in this, because in order for us to tackle all of this, we've got to understand all the routes by which transmission is happening, and then if there are further mitigation efforts we can do at the community level, there's not a lot more we can do, but if there are more things we can do, such as housing for workers and things like that, then we'd have to pursue those. So that this really painstaking process of talking to everyone on the phone for extended periods of time is critically valuable to getting at the answer to your question.
There's one thing I want to say is Dr. Gullett said that people are congregating, and so these are often young folks that are congregating. So we've talked about this before, that young people think they're invincible. They think I can ride this out, I'll recover and I'll be fine. It isn't about those young folks. Some of them may have complications, but also it's about their grandparents. It's about their grandfather, their grandmother, or their parents, or their neighbors. So they need to think about that as they're congregating, because they unknowingly could become part of a chain of transmission, and they don't want that to happen. So they need to heed these orders, because that's how they become part of the solution and step back and look at the bigger picture and understand that their choices can have implications for people that they love in the community, and they don't realize it. We want them to heed the order and stay home and not congregate.
So I wanted to ask, in terms of contact tracing and that work, how long do you see, that kind of work being effective? Like, does it continue, or is there a certain tipping point where you can no longer keep tracing all of those?
So the question is about contact tracing, and is this something that we're going to indefinitely do, or is there a tipping point at which this strategy is no longer sustainable? So that's partly why I made the comments I made in my prepared remarks earlier about being absolutely determined to continue case identification, isolation, and contact tracing as the cornerstone of our approach. We have a multifaceted approach with multiple other arms of the work we're doing, which I've talked about at other press conferences, but that still remains the cornerstone for the reasons that I was describing in Scott's question, as well as understanding, really that's how we help people one by one understand how to get through this, and that's also how we make connections with people so that they know if they become sicker, we can get them to a higher level of care. But we never want someone to die from this, but particularly at home. And so, one of the other things we do when we connect with people is to make sure that they have access to our physician line 24/7 so that we can help them navigate when they need a higher level of care. And we have sent in many people over the last week to the hospital who were decompensating or becoming sicker at home who needed a higher level of care. And that to us is part of minimizing the loss of life so that we can get people the right care at the right time in the right location. One of our doctors here yesterday, last evening, came to me after a particularly hard day of case interviews and said, I don't know how much longer we can do this. And we had a really honest conversation about the fact that this is so important. And he's very committed, absolutely, but he had that exact question you had, Ginger, which is, at what point is this not sustainable anymore? We're doing, we come into 50 plus cases a day and there are only a handful of us calling and we're just staying here because long hours to try to get these people called. But what we talked about was that there may be a tsunami coming, right? We might see it off in the distance, but we still have time to get as many people as possible to higher grounds and safe away from the storm that's coming. And that to me is that no one is left behind, that we fight for every single person in this community. And so we are a health department that with our extenders and our relationships with the medical school and with other health professions groups in the community, we have a lot of resources to draw upon, and we have a lot of volunteers here that are working these cases for us. And not every health department has those kind of resources, but everybody is trying to maximize the response in the way that they can with the resources they have, which is partly why it's so important to fund public health, so that in times like this we can flex up and we can get a workforce in to continue to do this. So with the resources we have, I don't foresee a time, at least in the near term, where we're gonna abandon that strategy. There are parts of the country where they can no longer do that, and I've talked to some folks in New York in the past week who don't have the kind of capacity, given the overwhelming number of cases, to do the level of detailed case identification and contact tracing we're doing, but they've been overwhelmed with thousands of cases in a high density area. So we're gonna keep working our strategy here with our army of people, and we'll continue to do that as long as we possibly can.
We'll take one more question.
You talked Friday about still investigating dozens of clusters. Can you kind of give us an idea of what those clusters look like? Are they residential care facilities, nursing homes? What sort of things are you seeing out there?
Sure, so the question is, can I talk a little bit more about the cluster investigations that I mentioned on Friday, and what do those look like, and what are we seeing? Absolutely, so one of the arms of our work here is cluster investigations, and that comes usually out of case histories. So when we call people, we learn about their lives. They're very gracious and generous in sharing details of their lives over the past few weeks so that we can understand when they became symptomatic and who they may have been in contact with who might be at risk for the infection. That's really important. And so as we walk through that, we begin to identify places where people have been, and then we start to put the pieces together about that. And sometimes we get multiple cases that then link up through our history. We say, oh, well, we learned about this or we learned about that, and then we put them together. We have a very detailed wall that we're using actually of multiple case clusters so that we can piece together the stories of how people's lives have come together and where we might need to target intervention for other people who could be at risk. So in some cases it's a social interaction that people had, a particular organization before the stay-at-home order. We had people who were congregating in a social place because that's their social outlet, and so those people actually were clusters in particular. There's several social places that we identified. Others were families or family clusters, multiple families on the same street or in the same area. Others were long-term care facilities or skilled nursing facilities. Others are in other kinds of businesses where employees became sick and then other employees became sick. So we go after every single one of those, and it's part of the creativity of what we do is trying to piece those together. If you're not really careful about the history, you can miss those. But we're really trying, I'm sure we have missed some, but we're really trying not to miss any so that we can work closely with the organizations affected, and we can make sure that infection control practices are optimized, and that everybody who could potentially still be at risk is actually made aware of that, and then we get them before they become sick and then infect other people in their homes or other people in the workplace. So certainly the efforts at the state level have helped that because people are not going to work if they don't need to and their temperatures are being checked and things like that. But these clusters have led us in a lot of different directions. We also work very closely with our state partners, so whenever we identify a cluster, we work closely with the Ohio Department of Health and other Ohio state agencies who then offer us support to be able to help the affected organizations here locally. So it's really a way to minimize transmission, but also ensure support for everybody that may need it going forward.
Are there dozens of those still under investigation?
Yes, I would say so. I mean, we're not the only jurisdiction, you know, there are 100 and how many?
113.
113 health departments in the state of Ohio, all working clusters. So, you know, you have hundreds of clusters across the state. In the higher density areas, the larger cities and counties, you probably have more. But we have capacity to do that and to do these investigations, and so we're really taking that seriously. We assign a physician as the lead to every single cluster investigation, so that there is somebody driving that investigation, and that there's a point of contact for any organization or group of people that's affected, as well as to liaison with the state officials.
One piece, along with Dr. Galt said, there's a reverberating power of this work we're doing around contact tracing. And that's telehealth that's happening at the hospital systems. I talked with Dr. Akram Boutros, the CEO of Metro Health. He checks in with us. He's a great community partner. And he said that they have, through their telehealth lines, and all the systems have them, he said that they've identified 2,000 people that have been ill. And they may be for a range of illnesses, but they are basically giving a quarantine guidance. Stay home for a couple weeks. That prevents people who are ill, who may not be tested, may not necessarily have COVID-19, but can then be sort of told to stay home and not potentially become part of a transmission cycle. So that compounding power of telehealth with case contact tracing and working to assure that people are following quarantine and isolation orders, all these things come together along with the mitigation strategies around social distance. So we are working in unison, clinical medicine and public health. They will continue to do that together, and we look forward to coming back on Wednesday for our next